Actually, policy and research is not reserved for a few people, like professors. Policy and research is for everyone. Even at household level, you should be able to do some research on how to improve the performance of your kitchen. And we can do that at community level, at national level, international level. So research and policy should be done by everyone. And so nurses became more aware that indeed they can actually be involved in policy. They developed their capacity to understand the policy cycle, the policy processes. So knowing the policy steps, then they were able to identify what are the entry points for influencing policy. So they were more comfortable in engaging in policy. And in the end, members of hubs were recognized as bona fide partners in research and policy making. And that recognition also increased, of course, trust and respect, and the fact that then they would often also be consulted when decisions are being made. The second, of course, is the networking aspect, which also they describe what they experience in terms of networking. The means of networking was, again, meeting together for activities as training, and also just meetings like conferences. We also had a quarterly newsletter in which all the hub members from the different countries made contribution, and that was a very useful element in enhancing their working together. So you can, I believe, see it better in the middle. We have the outcomes of networking, and at the end we have the impact of what we think was going to be lasting change that occurred as a result of networking. Don't forget that all this time, all this was controlled by the National Advisory Council, which was led by Madame Oyuer. So they were guiding us as to what was the aspects that we needed to delve a bit more into, guiding us into what analysis we should carry out to provide information for what the nursing system and the health system in general was actually looking for. So in terms of vantage positioning, I already mentioned that the nurses felt that in the leadership hubs, they were appropriately located to take advantage of resources, to take advantage of opportunities, and to take advantage of possibilities for influencing change. And that they used that in that they were then better able to access the policy chain. They were better able to participate at times when decisions were being made. And in the end, it increased their voice, and they could be heard louder and more clearly because they had also learned how to communicate, how to advocate, and they also had research results that they were bringing to bear. They had evidence of what they were trying to advocate for. Of course, we had lingering issues. The entrenched top-down structures in the health system cannot be changed overnight. The issues of workload, because people, there is underemployment, and therefore the workload is horrendous. So finding time to go for hub activities may not always be easy. And then people are transferred and moved from one district to another, so they are not able to continue participating. The historical disconnect, which of course hopefully eventually gets addressed as many of these take place. And then of course the differences in levels of formal education was an issue before, but I believe that we have all contributed to accelerating greater opportunities for nurses to catch up in the area of basic qualifications that they have. Inadequate awareness of their rights to participate. I believe that, again, this is an area that advocacy is needed in, so that nurses understand that they have equal rights to engage at any level, and therefore to go for those structures and levels of participation. So in the end, these are just some summaries, some summary statements, which you can, I believe you can read them better than I can. So I will not try to read each one of them, but simply to say that this model seemed to have transformed the nurses that engaged in it. And one of the results was that most of those members who participated in the hubs went further in formal education and in professional growth. Many of them gained their degrees, many of them gained their masters, and I can even suggest that more than 10 gained their PhDs during that time of engagement in these hubs. And so I present to you the 3 pathways for accelerating empowerment of public health nurses to engage in UHC. Thank you.